kidney stones affect 1 in 10 Americans, they also can affect 1 in 200 pregnancies. That's extremely anxiety-provoking, definitely for the patient, but also for the providers, because the stakes are quite a bit higher. The uterus itself is physically involved. When the baby gets larger, it can compress on things, cause there to be some dilation of your kidneys. You just have more blood volume overall, and your filtration systems are a little bit different. Whenever we intervene, a lot of pregnant women get crusts on their stents or nephrostomy tubes as a result of being pregnant. So there's been a lot of inspiration for trying to find out the best way to manage pregnant women with kidney stones that need to be managed operatively. About 10 years ago, they published showing that ureteroscopy can be done in pregnant women, but the risk of preterm labor within that series was 4%. So we sought to provide an update. What we did was we teamed together with 7 institutions and looked at our experiences with doing the ureteroscopy in pregnant women and finding out how safe is this. The collaboration between obstetricians and urologists is imperative when dealing with these situations. Most often we rely on CT scans to obtain an idea of if there is a stone, how big is it, where is it? All of that is very important in deciding what to do. Getting radiation, getting that CT scan can impact the fetus. So the obstetrician is needed to best decide together whether or not it's necessary to undergo that risk and expose the fetus to radiation in order to get the best course of action. Furthermore, if we do go into the operating room, the obstetricians have to determine the health of the fetus. So another inspiration of this study is to try to standardize things. Some institutions required an obstetrician to be in the operating room, present during the ureteroscopy. Some institutions only required that the fetus be evaluated before and after with fetal heart tones. What we found was that regardless of how it was managed, the outcome was the same. There was no evidence of any preterm labor induced by the ureteroscopic intervention. Regardless of maternal age, regardless of trimester, we were able to do ureteroscopic intervention safely without any obstetric complications, which hopefully relieves the anxiety a little bit to speak that our past experience demonstrates to us that ureteroscopy is a safe option during pregnancy in experienced hands.